Welcome, everyone, to the first podcast from Visiting Angels in Rochester, Minnesota. This is Angels at Home Elderly Care Conversations.
Beautiful. This is our first ever podcast for both Tara and myself. My name is Aimee Tucker, and I am the operations director for Visiting Angels in Rochester, Minnesota. I've been there for 13 years. Prior to joining senior home care, I was a corporate trainer for about 20 years before that. It's a long story how I got into this, but the point is, this is where my heart and passion is now. And we also have...
My name is Tara Thomas. I am a registered nurse and a board-certified ambulatory care nurse. I started with Visiting Angels about the same time as Aimee. This is definitely my passion. I have over 30 years of nursing experience in various places, and there is nowhere else I would rather be right now than working with the people that we serve.
Awesome. So today, as our first podcast, we're just talking about home care, senior home care in 2025 and what that looks like. And I think the first thing that we want to cover is just why home care, right?
Exactly. And I'd say the number one reason why we do home care is because that is exactly where everybody wants to live for all of their lives. And what we want to do is support that and help our clientele live at home their entire life.
I think there's a big misconception out there that affordability of home care versus a facility. And there's a lot of things that have changed, but I really liked what you said the other day we were talking about. And that is, I think the question was posed to us, why home care versus the traditional nursing home? And you were like, So I like what you were talking about with using the word traditional and relating it to senior care facilities. And you said...
I said that the traditional care for our elderly family members has been the home. The skilled nursing facilities are something that's been new, that was new in the 20th century, where you could phrase that my grandparents and parents used was put me in a home. And really what we strive to do is help you to remain in your home.
Right. So traditional then is being in your home, not in a facility. Right. So we go back to that cost thing that, that's how I walked into this saying, I think that there is people, it may not come to the forefront of their mind because cost. What we have found is actually being able to stay in your home is more cost effective than going to a facility. It's actually cheaper than being in a facility.
I would agree with that wholeheartedly. Most people, once they reach, the years past retirement, if we're retiring between the ages of 65 and 70, most people are not needing help in their home until they are somewhere in their 80s, if not 90s. They own their home. There is no monthly mortgage payment. There is no rent. They're in their home that they own. It's the biggest asset that they have. And it's the biggest, probably for many people, the biggest inheritance that they're going to leave to their children. And being able to leave something behind for your children, just it's a way of taking care of them even after you're gone. So when you go into a nursing home, you need to spend down everything before Medicare will kick in and start paying for that, which means you no longer own your home.
Right. And I think the other big misconception is not everybody needs 24-hour care around the clock. So when you move into a facility, there's that cost, whatever it costs to live in that facility that you don't own. That's whether you need 10 hours a week of care in your home or 24 around the clock. So that's a cost that you're going to absorb no matter what. Whereas if you can bring people into your home that can expand the care needs as you go along, that cost expands or decreases depending on the level of care, correct? Versus a facility where you start at this baseline, it's going to stay there, and then they're going to add on as level of care continues.
And that's just the financial cost, and we can get into other costs later, but there's a financial cost, there's an emotional cost. There's the cost the toll that it takes on physically having less space and the loss of autonomy that people have when they need to move into a skilled facility. I also want to clarify, we're not saying that a skilled facility is a bad place. It's a necessary place for a lot of people. But most people, if you talk to them, their goal is not to need to move. And we're there to support them as long as it is feasible for them not to move.
Right. You touched on that emotional piece. And we were talking about how I think a move ranks like number 3 in the top stressors of things that can happen to you in your lifetime. A move is number 3, whether you're 18 years old or you're 80 years old. It takes an emotional toll by itself. You add on aging, normal aging, and possible medical diagnosis such as dementia. It's going to cause setback. Sometimes we move into the assisted living facilities and we're not prepared for the step ups, which is going to cause 2 or 3 more moves. If at some point in time you have to move to a skilled part of a facility, if they even have that care option available, or you're moving to a completely different facility, which usually then, if there are 2 people, causes them to be separated. Where in the home, that's not going to happen.
Right. You can look, even if you're looking at a senior living facility that has a continuum of care where you might move in to an independent part, that you can go from there when you need more help to assisted living. And from there, if you can do it all in one campus, that's nice, but it also frequently separates spouses and the costs keep going up. And this is a cost that you incur for the rest of your life, but you don't have anything once you're gone. It's the cost is over, but there's no home left to sell. Your assisted living apartment, your memory care room, that goes back to the facility for the next person who needs that.
Yeah. Let's talk technology and things that have changed in the last 13 years since you and I have been doing it. That makes aging in the home easier. You were talking about, I don't know, these weird GPS shoes. I couldn't follow you because I hadn't heard of that yet. What was that?
One of the behaviors that you see with people with a dementia diagnosis is wandering. They want to go, but when they go, they forget where they're going. They forget why they are going. And it's probably the scariest moments in anyone's life when all of a sudden your loved one they're missing. Where are they? How did they get out? 13-15 years ago, the options were to put a motion detector doorbell on every single door so that if it opened, it would make a ringing sound and hopefully other people in the home heard it and could
Right.
act on it. Now they make shoes with a GPS tracker, or you've got the Apple AirTags or equivalent, where you can take the AirTag and put it in their pocket, or you've got the shoes that actually have a GPS link in them that you can see on their phone where this person is going if they left the home and went out for a walk. And it gives you the opportunity to go meet them on their walk and redirect them gently and get them to come back into the home where you know where they are.
Right. And there's Ring cameras. Right now, I just got a Ring camera for myself, and I'm a little bit obsessed every time I hear the little ling, 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 and then I watch, and it's a bird. It's somebody walking in the street in front of my house. But, there's Ring cameras and they can go inside. We have a lot of clients that actually have some sort of internal monitoring inside the house where family And you and I have talked about this. A lot of family lives many miles from home. Not everybody is fortunate enough to be in the same city as their parents. And so having that internal monitoring system, um, and you can set them up all kinds of different ways where, you can only get in if there's been motion in that area, right? So you're not just sitting there watching everything that they do. There's Apple Watches that can detect movement, oxygen, blood pressure. Not blood pressure. I'm not sure if it does that, but it does.
Apple Watches can detect a fall. They can detect some irregular heartbeats and alert the person.
Right. And we were talking about last night, is it Lifeline? Life Alert?
The Life Alert is the name that most people are familiar with.
Right. But there's those type of devices. I like what you said about um being more apt to wear that. Is that where or were you talking about the Apple iTag when you were talking
Right.
about
The AirTag could go on a piece of jewelry or a watch, or the Apple Watch with the share my location app. And I am sure I am most familiar with Apple products. I am sure the Android products, the Google products all have the same thing
they
of like
do?
find my friend a location, so that if you're giving it to your parent or to your loved one, you just program it how you need it for what is best for them. Because just like they want best for you, you want what's best for them. It's programmed. I can always see where mom is. I can always see where, my aunt is, or whomever it is. I see where they are, so I know how they're doing. The
Right.
Apple Watch will detect a fall. It can find them somewhere even simple. If you were just going into a store,
Right.
if in the grocery store together, it's good for people to get out. It's good for them to walk up and down aisles. And it's good for them to have a little bit of autonomy and not need to be babysat if they are at the mall, or at Target, at a store. And when you do that way, you can see where they are, and then you can find them.
Right. Oh, just there's also bed motion type things. 'Cause I know we've had clients that have had the monitors so that our caregiver that is doing the overnight doesn't actually have to be in the room with them. They can be outside of the room and actually sense motion, right from a screen. But there's also like bed alarms that you can get too, right?
You can get pads that are sensitive to pressure. And so when a person gets up to leave the bed, especially if they do need an overnight caregiver, when they're restless and they've sat up in bed or maybe tried to stand, the caregiver is able to go immediately in there at the sound of the alarm, or just having a video monitor where the caregiver can hear them starting to get restless, but maybe they're just rolling over, or they can look and say, you know what, they're trying to sit up. Maybe what they need is to go use the restroom.
Right. The other thing is like Google Home devices, or just Google Alexas in general. And you can program, we've had clients, you can change the name. So if, an elderly person cannot remember, like, hey, Alexa, you can change the name to be something that they would remember. Um, like the name of a pet, and you say, hey, hey, Bob, or hey, Mary, and the Alexa will come on and you can say, call Tara. And it'll call Tara. And maybe mom is stuck in a corner of the room and she can't get up. Um, you might not want to life alert that, but you could program those. We've also had families do sync calendars with Google and Alexa Home, so that um, the family member gets reminders. So Alexa will say, good morning, Tara. It's time to take your meds, or don't forget you have a doctor's appointment, or Sally will be visiting you today at 11 o'clock, and it'll come through the speaker, which is really cool. We've had families do stuff like that with the Google Calendar. Um, and then there was one you were talking about too with medications. There's quite an advancement in medication delivery.
The machines for medications are absolutely amazing, and they've changed so much in the past 10 years from just something basic where it would you'd have a compartment flip open and maybe beep to they can talk to you. You can program it to have mom's. If you press 1, you get mom's medication. If you press 2, you get dad's medication. They can be preloaded if you have a parent that's on a very consistent medication. You can preload them for up to 90 days worth of medications, where you just get that. Once you have a continuity of routine, you keep that up, and it's very, very healthy. That, okay, I get up, I have coffee, I have toast, and the medication pops open and reminds me to take it.
Yeah. There's also, I mean, this doesn't really fit with technology, but there are things that you can do to your home. We have a company here in Rochester that will come out and do simple remodeling things that make things easier that we don't think about, but like professionally installed grab bars in the bathrooms and um, all kinds of things that they do. I can't think of them all off the top of my head, but they come in and do free assessments for families. So that's another thing to make the homes safer and um, livable longer. you know, so there's that too. So lots of technology, medications we talked about. I think the quality of life being at home. You were talking about mental health. Um, that I hate to use the C word, COVID, but I mean, we always knew that loneliness. What are some tips that we can give people out there listening? I have one that I want to throw in there right away, and that is my first thing for somebody watching this, and have conversations with your families. If you're the adult child of aging parents, start having conversations now while you can. Just understand what your parents want, or the loved elderly person in your life. It's so important to know what that is. So often we get families calling that are in crisis, and it's never convenient. And there's a lot of things you need to know. Like, number one, does your loved one have long-term care policies? A lot of families bought these long-term care policies, or it came with um, their career at the time, and they have them and have been paying on them for years. But there's so much you need to know. Like, do you have a long-term care policy? Is that something that you can work with? So find that out from your parents. And we could do that on another podcast, but there are some great questions if you find that they have long-term care that you need to know in advance. But what you need to know first is, what do your parents want, or what does your elderly loved one want? Do they want to stay at home? Most likely it's going to be yes, but sometimes we hear things like, you know what? No. I want to be in a facility. I want to be done with the house and so find that out is my advice. But then once you find that answer, whether it's a facility and they want to move, or because then the question is, when do you start doing that? Um, and then, because a lot of facilities have waiting lists, right? I know here we're on a 2 to 3 year waiting list.
Which is absolutely amazing, because when you know that I want to live in this assisted living facility and I'm not going to be able to live there for 2 or 3 years, if you're 75, 80 years old, you don't know where your health is going to be in 2 or 3 years. So, you may need home care in the interim. That's
Oh, yeah. There's that idea too.
that's definitely, so you might be looking for help. One of the things, Amy, that you said is having these crucial conversations with your parents. Find out now what they need, because they might be doing just great. And one of the things that I learned when I started work at Visiting Angels, at the time, I was in my mid 40s and I was having to have these conversations with families. And what I made a personal policy of mine is I'm not going to ask somebody else to do something that I am not willing to do. So these are conversations that I've actually started having with my children when I was way too young to be having them, in my opinion. Uh, or, and they were just looking at me like, why are you doing this, Mom? Why are you making out an advance directive? And it's like, so we can talk about this. So it's not a hard conversation to have. And sometimes it might be that adult child who is in their 30s or 40s or 50s going, you know what? When I'm 75, I do not want to be mowing the lawn. I want to have the money to pay the kid next door or pay a lawn service to mow the lawn.
Right.
Um, I really don't like cooking. I like home cooking. I just don't like having to cook. I want somebody to come into my house and help me make some meals.
Right.
When we start having these conversations early, then we know later, because later it becomes an uncomfortable conversation, or you can have a defensive parent going, I'm just fine. I'm just fine. Or I don't want to burden you, because parents, as they age, they see your life get busier. You're working, your partner's working, you're a single parent, you're raising your family, you're trying to hold your home together, you're trying to go to sports practices, you're trying to help this one with grades, and then you're trying to have a relationship as an adult with your friends and your partner. Your parents don't want to add to that. They don't. They're like, oh, don't worry about me, I'm just fine.
Yeah.
Maybe.
I think the other, like, if you're out there and you need to know your options. So whether it's a facility, or home care, who are the agencies that serve your area? You're going to want to know that. Because you'll find that depending on where you live, and if I just take Rochester, Minnesota as the example, we have a lot of, outlying areas in that. And so, we cover all of Olmsted County and some of Mower. But we don't always have caregivers very well established in some of those areas. So, a lot of who you're going to pick is going to be who serves your area. So, that's going to be one. You're going to want to know minimums. Almost all home care is having a minimum amount that they will come out both weekly and daily. Weekend availability, time availability. Some people, some agencies are going to be they're going to have the staffing for days, Monday through Friday, but they won't have weekends or evenings. What does your family need? So availability is going to be a big question. Cost, um, contract minimums. What does your family need? How do you grow in that? But you brought one up the other day, Tara, that was about continuity of care, because that is a big thing. How many people are going to be parading through my home? Right.
Well, our homes that's our private space. That's, it's like you come into my home because I'm inviting you into my home. And you want to know, how fast can the agency put together a team of caregivers that's going to be this consistent 2 to 4 people, depending on your needs. How often, is it going to be the parade of faces, or within 2 weeks we're going to have a stable team there for you that's going to be able to cover for each other during vacations. And those things are very important. Also, finding out, the state of Minnesota requires its home care agencies to be licensed. and they have one of the most comprehensive home care licensing. It's very impressive. You have to have an RN on staff. You have to have an RN available. You have you have care plans. You have continuing education requirements. You have screening. We screen all of our caregivers. Not only do we very thoroughly background check them, we also screen them for tuberculosis. All of these things are very important. What if you need somebody during the day? What if you have a question? How do you reach the office? Are you going to get a recording?
Right.
Going to get a hello, you have reached this office. Press 1 for this, 2 for that, 3 for the other. Nobody wants that when they're asking for help and they're needing help. They want, and this is what you get with, visiting angels Monday through Friday, 9 to 5, is you get, hello, visiting angels, how may I help you? You get that actual person. And then if the next person you need is one of the RN case managers or the client care coordinator or the scheduler, then that person is on the phone.
Yep.
And we also have after hours communication. We're there for our clients 24/7.
Yep. So that is a good question. And I also like the question of the continuity of care and how you want to know from the agency, if I'm requesting everyday care for 4 hours, 8 to noon, um, Monday through Friday, how do you handle if a caregiver doesn't show up or if a caregiver's sick? And how is the schedule communicated to us, to you, the client? You want to know how do we know about the schedule? We personally have a portal. And that's something we didn't talk about on technology too, that I think is really great, is our portal, and all of our caregivers are required to chart electronically and leave notes that family can get in and read, and they can actually see what was done for today. But another question I think people have that have not done anything with home care is like, how do I actually know that the caregiver is there where they say they're going to be? And our our timing is all GPS located, so our caregivers cannot clock in and chart and do anything unless they are actually physically in the home. Not even in the driveway. They have to be in the home before the system will even allow them to chart anything, which is great, because I mean, families want to know that. How do you have that assurance that they're actually there when they say they're going to be there? You know, 13, 14 years ago, it was all on a piece of paper. Yeah, I went there and I claimed things. So, so yeah, knowing how that accountability is. I think post COVID, we saw what it was like when our families couldn't interact with each other. So,
Yeah, I think during the time where we really had to shut down and not, you had to pick your bubble, pick your friends, the toll that it took on people's mental health was huge. And it took a long time for a lot of people to recover. Some people are changed forever. That social outlet and being able to see friends and family and have people come in and out of your home is huge. Having a caregiver come into your home that knows you and knows your routine and learns your home and is a new friend. It's somebody to visit with. It's stimulating mentally and emotionally.
yeah. And for our caregivers, I know, I absolutely love the magic of watching the bond form between the caregivers and the clients. Our caregivers would tell you that um, they feel like they get more out of the clients, learning about them and caring for them than the client does getting care from them. I mean, they would say that 100%. Um, this job, not everybody can do it. We have 115 caregivers, and 100% for 98% of these caregivers, it's not about the money and making a living. It is about um, making the world a better place. and they feel that every day, and that's why they do it, is they love it. They know they're making a difference. They know they're making our clients' lives better. So, and I know our clients, they will call and they will say, they will worry about our caregiver if, they're not there a day. What's going on? Where is Sally? I miss Sally. When will she be back? And it's just a beautiful thing. So I love it.
Not everybody has that privilege of working a job that they know that every single time they go into somebody's home that they're making a difference in that person's life.
Right. Other things that we've had to ramp up, there's the mental health and loneliness, depression. But I think the other one is Alzheimer's, dementia. We've put a lot of time and energy into dementia training.
We spend a lot of time with dementia training when our new caregivers come on board with us for their orientation. And then that doesn't stop at then. Our support for our caregivers when it comes to dementia training is we look at a lot of dementia experts. I've gone to several conferences in the past that are just geared only toward dementia, what we're learning, how it, things, how technology is developing, medications are developing, and then just how do you live with this changing mind, because it's an illness that is affecting your mind and your memory. We do extensive training every year, annual training with our caregivers on dementia, and then you always have a nurse available to you.
I just wanted to talk along with all the training that you were just speaking about that we do. I mean, there's been such a need for it because I don't know if you remember, but when we first started, the census was about 40%. 40% of our clients dealt with some sort of cognitive, if not a diagnosis of dementia, Alzheimer's. Now that number, if you do a census of all of our clients, is 85%. And that's just in the last 13 years. So we have to provide training on that. And the other thing that Visiting Angels Rochester, Minnesota does is we do free community training. So we bring in experts to talk about it. We do trainings and community events where we're talking to whether it be not just our caregivers, but families that are caring for loved ones that have that diagnosis. And we do those for free. We have at least one or two a month that we're doing out in the community, and we just are sharing what we're learning. So that's a big one, just the dementia care. So
I think that dementia is just going to be an ongoing conversation and an ongoing topic for our podcast because there's so much going on. And I also believe that when you talk to people who are older, if you can pick one thing you don't want, I would probably say the same 85% would pick. I don't want to lose my mind. I don't want to lose. I love my life. I cherish all of my memories. I love the people in my life. I don't want to forget.
right.
So it's devastating to friends, to family members, to the person who has that diagnosis, because in the beginning you remember that you have it and you progress to a time where you don't even know that you don't remember anymore. So I think that's going to be a frequently revisited topic.
I agree. One more thing that I wanted to get to on this first podcast is what should families look for when they're out there shopping for home care options today? What I can say is that when it does do that, it's doing that for everyone. So we're all flooded. So we are doing the best in those moments that we are flooded to get services started as quickly as possible. There are other times when, I don't know, it just goes a little bit quiet. So, like you said, Tara, if you were to call and it was one of those quiet times, we could literally have the assessment, our client care manager come out and a caregiver at your doorstep. Not quite like Amazon Prime, but close. I mean, close. So it does all depend on all those things. But
No, I want to bring up one more important thing we can do,
okay.
because somehow we didn't touch on this on our list of topics to talk about, is bridge care. What if you don't need somebody indefinitely? What if you
Right.
are going into the hospital and you're having your knee replaced or your hip replaced, or you fell and you broke your arm and you're going to need help for 4 weeks or 6 weeks? Who comes in who comes in the house to help you? If your family is, spread far and wide and living in different states or cities, and you need someone coming in, once a day, twice a day, a few times a week, we do that too. It
Yep.
doesn't have to be uh, it doesn't have to be you started and now you're never going to get rid of us.
That's
You-
right.
For some people, we're there. You're having a hip replacement. Okay, we're going to be there. We're going to help you for when you get home, and when you've regained the independence that you had pre joint replacement, then we're going to phase right out. We'll miss you,
Yep.
but
But we do want that.
we do want you to fully recover. If you've got a new cancer diagnosis and you're going to be having a surgery, maybe followed up with radiation therapy that you need rides to every single day for a month, we're there for you.
Yep.
You've got chemotherapy for 6 months, so you're going to be tired. You're going to need some extra help. You're going to need some meal preparation. We're there for that too. We can
Yep.
be there. You might need somebody, to just for a little bit while you're recovering. Some families have a loved one on hospice. Hospice is something else we talked about.
Hmm. Yep. We do work right alongside hospice. Typically when someone goes on hospice, they think, well, we don't need care in the home because we have hospice. Hospice is not designed um, to cover long hours. They're typically in, you said once a week.
Depending on the need of the patient enrolled in hospice,
Right.
and there you've got a nurse, an RN case manager that comes in and does the assessment and the admitting. And then depending on where they are in that disease and dying process, you might have an RN will visit a minimum of once a week.
Yep.
More, absolutely more if necessary, but they're visiting for something very specific. It's not somebody that is in the home 24/7 or even.
Doing the laundry, doing the oral care, doing that. Yeah.
And that's where we have a wonderful working relationship with all of the hospices in Rochester, and being able to support a family and augment the care that hospice provides during that last period of a person's life is just an incredible gift and privilege to make to help the person live with quality the rest of their life.
Yep. I think that is the end of our first podcast. We promise that we'll get better at this. Angels at Home Elderly Care Conversations. So we plan to hop on and do this as time goes on. Tara and I would like to invite experts on different topics, and we'll advertise what those topics be, whether it be dementia or we talk just about long-term care, or, we will have a topic and we'll invite experts in as time goes on and we get a little bit more comfortable with delivering the information in this environment. We want you to subscribe to our channel.
Angels at Home, Elderly Care Conversations. And in the comments, we want to hear back from you. We want to hear, hey, talk
What do
about
you want to talk about?
yes. What do you want to hear? What do you want to know? How can we help you?
I agree. See you next time. Forgive the the newness of this all. Welcome to Angels at Home, our first ever podcast. Elderly conversations. Nope. Angels at Home. Elderly conversations. No. We want you to subscribe to our channel, Angels at Home, Elderly Conversations in the Home, right? Elderly Conversations, Elderly Care. You do it, Tara. You do
We're
this
gonna
part.
have bloopers reel.
Okay, you do this part.
We're gonna write that.
I know, it's got to go somewhere here.
Hi, Flora.